Hello, and thanks for joining us. Today we're going to take the perspective of inpatient care in a hospital, care provided by the hospital to a patient who has been admitted. And we're going to specifically review reporting aneurysm repair. Dun, dun, dun. Okay, so let's start with what is an aneurysm. You may have heard this word, probably depending upon your age. But basically, it's a weakness. You know, the blood vessels, the arteries and the veins that go through the body are just these tubes, right? And on occasion, a portion of the wall of the tube may weaken. It may thin out, and a bubble might present where the blood, remember, the blood is flowing through this vessel, and the pressure of that would cause the balloon to kind of pop out. As you can see in our picture, that little bubble thing almost looks like a kidney bean right in the center of the picture, is that shows an aneurysm. They don't all look alike, but that's gives you a good idea of what it might look like. Okay, so what would cause this? It could be a congenital defect, something that happened in utero while the baby, the fetus, was growing, and these blood vessels were being created. Okay. As a human, once you've been born, more often an adult, hypertension, high blood pressure, hyper meaning high tension pressure, high blood pressure, like the water racing through the pipes in your house. And you can imagine that that you turn on the faucet and the pressure is so forceful, it comes out, it could break a dish sitting in the sink. Okay? And think about what that high pressure racing through these delicate arteries and veins throughout your body. Another cause can be hyperlipidemia, which is the medical term for high cholesterol. Hyper meaning high, lipidemia is the condition of cholesterol, and this is plaque forming on the inside of the vein. Now you might say, well, if plaque is forming, that should fortify the wall, right, of the blood vessel. However, in an area that is not covered with plaque, due to the backup, the plaque is going to slow that blood flow down. Think about a multi-lane highway during rush hour, and one or two of the lanes are blocked. So now all the traffic is slowed down. And then you start seeing these cars that try to cheat and ride on the lanes on the side of the road that are not official, right? So that can cause that aneurysm, that push against the wall. Cigarette smoking, yeah, well, okay. I used to smoke cigarettes. I've yet to find an official good side to it, although I still remember it. Okay, and illicit drug use, and I would say anything that uses the word illicit is not going to be good for you. All right, so what happens? How do we confirm a diagnosis? Well, of course, the only way we can really do this is with imaging, because the clinician, the qualified healthcare professional, physician or nurse practitioner, has to take a look at the blood vessels and see if a weakness is detected. So the usual, CT scans, computed tomography. Now remember, today we're talking coding from the hospital perspective. So we're going to not use CPT codes. We're going to talk about ICD-10 PCS, procedure coding system. And ICD-10 PCS always has 7 characters in the code and it is an alphanumeric system. No dots, no dashes, just 7 characters, always 7 characters. And the imaging section of ICD-10 PCS begins with the letter B as in boy, okay? So the CT scan to investigate a possible aneurysm of the superior mesenteric artery would be reported with B424ZZZ. Now, remember, of course, anatomical site is absolute. We have to know what part of the human body we are imaging. And of course, the same would follow if the clinician ordered an MRI, a magnetic resonance imaging. You're familiar with those, maybe. If we were going to inspect the thoracic aorta, we would report that with B330ZZZ, okay? And I just wanted to note an arteriogram, arterio meaning artery, gram meaning recording. In ICD-10 PCS, this is reported under the heading of plain radiography, like an X-ray, or fluoroscopy, all right? So bottom line, you got to read the documentation in the patient's chart from the radiologist. Okay, so now we're ready. We have determined a diagnosis, and that brings us to ICD-10-CM, clinical modification. These are our diagnosis codes that explain why the patient needed the care of a healthcare professional. And in this case, the magic word is aneurysm. Okay, so we have 2 code categories from which to report an aneurysm. I, and that's an I as in I, not a 1. Okay, you notice the difference between I-7-1. The 1 has a little cap on the top. Okay, so I-7-1, aortic aneurysm and dissection, is if it is an aortic aneurysm. And if the aneurysm is anywhere else in the body, we're going to look at the code options for I-72. Okay, and of course, those little dashes mean additional characters are going to be required after the dot. So let's just take a quick look, because there are 33 different codes in these 2 code categories from which you need to choose. And for the most part, the number 1 question is, as I've said already a couple of times, where in this body is this aneurysm? So you need the anatomical site of the aneurysm. And if it's an aortic aneurysm, they want to know if it's documented as ruptured or not ruptured. Now, I will tell you, if the aneurysm has ruptured, this patient is in emergency surgery before you even see this case, okay? And the I-72 code category is going to, as you can see, be a lot more straightforward, just aneurysm of where? The renal artery, the iliac artery, other specified arteries if you're sure. None of the other 32 codes are specifying the artery that is documented. Then you choose I-72.8 and make sure you attach documentation to say what that artery is. The health insurance company, as well as the Joint Commission, as well as any other reporting, is not going to accept just a generic other. So you need to make sure to attach that documentation. If you don't, they will hold the reimbursement and send you a little note and say, oh, really? Which one? So you're just delaying the inevitable and wasting time when the money could already be in the bank earning interest, okay? Now we have one more I wanted to tell you here, and that is I-72.9, aneurysm of unspecified site. And I have this from students, who are just learning, and that's great. You know, that's what we need to do. But their logic says, if there's a code, why should I never report that code? Because they put it there. And I'm going to tell you why you should never report an unspecified code of this nature. Aneurysm of unspecified site. Okay, so first, you remember a couple slides ago, we talked about how you would even diagnose that the patient has an aneurysm? You have to do imaging. If you're going to do imaging, you're looking at a picture of where the aneurysm is. How could you know that the patient has an aneurysm and not know where in this entire body it is? Nobody's going to pay for anything having to do with that, number one. And number two, you're going to make your doctor look like an idiot. With no money. An idiot with no money. Because how could you know there's an aneurysm if you don't know where it is? And how could you treat an aneurysm if you don't know where it is? Doesn't make sense. If it doesn't make sense, don't report it. Okay? That's just there as a catch-all. Just in case something I don't know. But don't use I7 2.9 if your providers would like to get some money, because it's not going to happen. Okay? I'd also like their names, because I would like to never ever go to that doctor. Okay, just saying. All right, so now we're on. We know for sure we have an aneurysm, and we know specifically where it is. And now it's time to code the repair. Okay. So the first thing we have to do, and remember we're in ICD-10 PCS to report this procedure, this surgical procedure, to help this patient get rid of or control this aneurysm, okay? So there are three of the most common anatomical locations. The thoracic aorta, as you know, I mean, it has its own code category, I-71, right? And you're going to report those aneurysms, or an aneurysm of the thoracic aorta, from the heart and great vessels section, which begins 0-2. Remember, in ICD-10 PCS, we never use the letter O. We never use the letter I. The letter O is too much like a 0. The letter I is too much like a 1. So they're excluded. So that O is always a 0. Okay, so 0-2, heart and great vessel section. Intracranial artery, that's going to be an aneurysm in the brain, the cranium, right? Your skull. Ugh, you really don't want to have that. But that would be reported from the upper arteries section, 0-3. And if the aneurysm is identified in the abdominal aorta, the splenic artery, the mesenteric artery, or the popliteal artery, those are all going to be reported out of lower arteries section 0-4. Now, are you wondering, well, how do I know if this aneurysm is an artery, is an upper or a lower? Worry not, because we have a guideline right there in the front of your ICD-10 PCS codebook. Okay? It's official guideline B as in boy, 2.1 lowercase b. And it basically says you're going to use the diaphragm as the line between upper arteries and lower arteries. Okay? The guideline is right there, but it's pretty simple. So this is why you had to take anatomy and physiology before becoming a coder. And I'm going to assume any of our clinicians joining us today also took anatomy and physiology. So if not, it's okay, because in the front of your well, it depends on which brand you get of your ICD-10 PCS book, but there's actually a diagram that shows all the arteries and the veins. Or you could just, if you'll excuse the expression, Google it. Okay. But that's how we know whether it's upper or lower. All right. The next, so we have the first two characters of our 7-character code, 0, 2, 3, or 4. Now we're looking at the root operation term. And this is really tricky, if you will. This really requires you to be as smart as you are. Okay? And that is because the root operation term describes the procedure, the methodology used by the surgeon to accomplish what needs to be accomplished, okay? But the typical language in op reports, virtually all surgeons will refer to this as a repair. But look at the bottom of this slide and you look at ICD-10-PCS's definition of repair, that is really not what we're doing with an aneurysm. So the two terms don't go together. But that's okay because you're smart and I'm going to tell you how to figure it out. So what we're going to do is we're going to learn about these procedures as you normally do when you have to interpret the documentation into a coding language to report what was going on. So the physician is going to say repair, but don't be fooled, okay? Now, the two most often used surgical techniques for helping a patient with an aneurysm are endovascular repair. Oh, there's that word again. We're going to talk about it. And aneurysm clipping. Oh, good. There's no repair word there. So let's take a look. Let's really get into what exactly are these procedures? What's happening? We're going to start with the endovascular repair. This really is the most common and also the favored way to repair or to help a patient who has an identified aneurysm in a blood vessel, okay? And that's because it is minimal invasion into the body. It's great. It's much lower risk and shorter time in the hospital, quicker healing time. It's a wonderful procedure. It's called a repair, but it really is not a repair, as you can see on your screen, because this process is for the surgeon to insert a stent into the blood vessel. Did you hear that? They're going to insert a stent and go up. They're going to make an incision by the femoral artery, which is the thigh. Just a little tiny, like 1 inch, okay? And then they're going to put a catheter in with a special tip, and they're going to thread this through the network of blood vessels until they get to wherever this aneurysm has been hiding. And we're going to deploy a stent, and you can look at the picture on the slide. That's pretty cool, isn't it? So the catheter just releases the stent thing, right? And then they pull back the catheter, and it's kind of like an inside sleeve that just kind of protects the walls and reinforces the walls of this blood vessel, so that the bulgy part is the aneurysm, and that's fine, but now there's going to be no pressure on it, so we don't have to worry about it bursting, which is the big concern, okay? So in ICD-10-PCS coding language, this is not a repair. This is an insertion of a stent. And when you look at ICD-10-PCS's definition of insertion, you're going to go, oh, yeah, that's exactly what I'm looking at. That's exactly what's happening. So your root operation term for this is going to be insertion, not repair. See? That's why you're smarter. All right, now we're going to move on. The fourth character, as you know, is going to be this specific anatomical site. And then we'll go to the fifth character, the approach. Now, as you saw in the picture, right? And as I described, all right, so the physician is going to make this incision into the patient's thigh to put the catheter into the femoral artery, okay? Percutaneous through the skin. Endoscopic, the catheter is going inside the artery. So we are going to use the approach, character 5, to report percutaneous endoscopic. Okay? Does that make sense? You want to look at the picture again? Here, you see? Okay. Well, we got here from that tiny incision in the thigh. So that's how we get percutaneous endoscopic. That's also why this is so favored, because you have a 1-inch incision that has to heal, not open heart surgery or open surgery, whatever. Okay. All right, so that's the approach. Next is going to be character 6, which reports whether or not a device was employed. And here's the thing, that catheter put in a stent that is going to stay in that patient forever and ever and ever, okay? And that is official guidelines B as in boy, 6.1A as in apple, says a device is coded if the device remains after the procedure is completed. So the physician is inserting that stent. It's going to stay with the patient after they close, and everybody goes home, including the patient. So we will report the device in for character 6. And just so you know, because that stent is placed inside the artery, right? Remember you saw it lining the inside of the artery. That means it is an intraluminal device. Okay? Intraluminal device. And then anything else will be in the documentation. Okay, for character 6. All right, so we look at an example, because I love examples. So the patient has been diagnosed with an aneurysm located on the splenic artery. Okay, a catheter was used to deliver a stent to the weak spot in the artery, right? Okay, and just an aside for those of you who are clinicians who may be listening, thank you for listening. By the way, I don't want to see documentation of 2 sentences. What, are you kidding me? Okay, remember, documentation is for continuity of care first, then reimbursement. But anyway, all right, so in this particular case, we would report ICD-10 PCS for the hospital's work, not the physician. Remember, physicians are always reported with CPT codes for what they do, no matter where they do it. This is to report the hospital's part in this procedure. 04H44DZ, lower artery, because that's where the splenic artery is. Insertion of an intraluminal device, this stent, into the splenic artery using a percutaneous endoscopic approach. How beautiful is that? Okay? Now, in some cases, because remember, the physician is threading that catheter through the femoral artery in the thigh. But the aneurysm could be in the torso. The aneurysm could be anywhere throughout the body. So there are times when imaging will be used during the procedure. This is not the imaging we talked about in order to determine if there's an aneurysm or not. This is during the procedure. Fluoroscopy is one of the most common, or video angiography can be used to help guide the physician, because when you look at that illustration of the vascular network throughout the entire body, I don't know. It looks like the roadway system of the United States at rush hour, right? I mean, there were all these bypass, there's all these side roads and all of that throughout the body. So we don't want the physician who's got the catheter to insert, we don't want them getting lost. So sometimes fluoroscopy, that'll be in the documentation. If so, you will use a separate code, an additional code from the imaging section to report interoperative imaging, during the procedure, okay? If contrast material is used, that would be identified in character 5 of the imaging code, okay? All right, so that was endovascular repair, and even though you can't see me, I'm using invisible codes because we've now established it's not a repair in the language of ICD-10 PCS. Okay? All right, now let's look at our other option for stopping an aneurysm from doing any harm to this patient. And this is called aneurysm clipping. And as you can see from the illustration, I swear that looks like a paper clip, but I don't think that would be sanitary. These are like really specially made metal, but they are metal clips that are applied. And as you can see exactly, now this is going to be on the outside of the vessel, as you can see, between the vessel and the balloon of the aneurysm. Okay, so basically cutting off any more blood from coming from that vessel to feed that balloon until it pops, that's the rupture. We don't want that. Bad rupture. Okay, so we're going to apply the clip between the outside of the blood vessel and at the neck of the aneurysm, the ballooned aneurysm, to kind of cut it off. No more for you. All right? Now, clipping is not a root operation term in ICD-10 PCS or anywhere else. So what we're going to do is we're going to look at what exactly this function of this clip is. And this clip is there to restrict the blood flowing erroneously out of the blood vessel and into the balloon. So we're going to restrict that, and therefore the root operation term is restriction. And that looks exactly to the intent of what this clip is. It just looks like a paper clip to me, but it's not. It really is not. It's a special, I'm sure there's a patent and everything, and it's specially made because, again, this is going to stay in the patient for a long time, right? This is not just okay, boop. It's not like getting a haircut. So it's going to stay there, so it's not a paper clip. Okay? So we're going to use the root operation term restriction when an aneurysm clipping is performed. Okay? Now, the approach is virtually always open because we can't come in through the blood vessel like we did with the endovascular repair, because then that would put us on the inside of that blood vessel and we wouldn't be able to put the clip on the outside of the blood vessel. So, therefore, we are almost, and of course the documentation will state this, okay? But I just wanted you to be prepared, okay? This is old-fashioned using a scalpel to cut open the patient, an open approach for character 5, okay? For this PCS, for the clipping, all right? Because there's no other way to get on the outside of the blood vessel. Okay? Now, again, as I said, a device is only reported in the code in the 6th character when whatever it is stays inside the patient after the procedure is closed, done, everybody goes home, and this clip is not going anywhere. So it will be reported as a device, and because the clip is placed outside of the blood vessel, right? Remember, you saw the picture. Outside the blood vessel, it is an extraluminal device. Outside. And the other details about the device will be in the documentation. Okay? All right, so patient has been diagnosed with an aneurysm located on an intracranial artery that's in the brain. The surgeon has determined that the weak spot would best be treated by clipping. And so we will report ICD-10 PCS 03 V as in Victor, G as in gorgeous, 0 C as in cat, Z. upper arteries, because that's where your brain is, way above the diaphragm, restriction, as we discussed, intracranial artery, open approach with an extraluminal device. Exactly like we planned. And again, clinicians, I put 2 sentences here because we're focused really on the other parts, but yes, I know your operative reports are going to be 5 pages long, single space. Thank you very much. All right, but that's okay. All right, so just remember, when you're using ICD-10 PCS, you are reporting for what the hospital has done for a patient who has been admitted into the hospital, inpatient only, to report the procedure itself. And then the surgeon will have their own medical coder reporting the same thing, only using CPT codes for the procedure. Okay? And just take it 1 character at a time and make sure you end up with 7, and easy peasy. Okay? Thanks for joining me today, and keep learning.